He is Dr. Ralph May, the Community Guidance Center, and he joins us this morning to talk about a very important topic. And Dr. May, good morning.
Morning, Todd. Thanks for having me.
It's good to have you. I sent you an email a couple of weeks ago, and I said, did you see this? And what a study it was. It talked about mental health in Pennsylvania and some really alarming numbers about mental health regarding people who live in rural communities. Right. And what is becoming a trend.
Exactly. Yeah. And we've known this for years, is that there's an unevenness in the availability of mental health services. Urban areas, large metropolitan areas, tend to have much, much more in terms of mental health providers and range of mental health services. But as you move out into rural areas, and Pennsylvania is no exception, the availability of appropriate mental health care drops off. Indiana's kind of like on the frontier. We have good supply here in a lot of ways, lacking in some other ways, but once you get out of Indiana, in our own county, you're, as you know, very rural, and the access to care is very limited for many of our rural residents.
And there's a pretty tragic result of that, the fact that there is not rural care. People, therefore, don't seek treatment until it gets to the point where they actually have to go and be hospitalized for much more serious things than maybe they would have, something that would have been caught earlier.
Right, and that's the idea, being we want to intervene with mental health disorders at an earlier stage. And that's like in any healthcare. You want to intervene in heart disease, you want to intervene in high blood pressure, you want to intervene in diabetes at a much earlier time, where you can treat the person on an outpatient basis so they can remain in their homes, they can remain in their communities. And so you don't want to wait until things get really, really bad. But when there's a lack of access to care, individuals will naturally put it off, wait, delay it. Well, I can't get there. Transportation's an issue. It doesn't work out very well. It's a long way to go. And they put off things like depression and anxiety and bipolar disorder. And those things then worsen. And by the time that we get to them, by the time they get to us, things need much more intensive treatment.
The people around those who are suffering from some of those conditions you just mentioned, they find themselves in a paradox as well, don't they? They see that there's a need, but they really don't see what their avenues are in order to get treatment.
That's right. And in general, too, while the trend is better than it used to be, Todd, mental health disorders don't rise to the top of the pile in somebody's life. They like to put off the depression, put off the anxiety. If it were intensive chest pain or something, they might be more likely to call an ambulance and go to the hospital. But with depression and anxiety and bipolar, people will tend to delay the treatment. They'll try to talk themselves out of it. Mostly because of embarrassment, stigma. I just don't want to admit that I have this problem. It's embarrassing. So that also adds to the obstacles of seeking care, even if you had a sufficient supply of care. So you've got that obstacle as well, and then access obstacles on top of that.
So when we think about the problem of mental health in rural counties, and I think Jefferson County was high up on that.
Jefferson County is very high, yeah.
On that listing of people who are really suffering from mental illness because of the lack of psychiatric care that's available to them. What should people do in those areas?
I think the first thing is you've got to become aware of what services are in fact available. A lot of people don't even know where their mental health services are or what is available. They don't even know how to reach out and find help. Now, we have a presence in Jefferson County. If you call us, we would be able to help you figure out what services were available. The issues become very complicated when you get into rural areas because it's also an insurance issue. That if you look at the insurance issues, is that if you have private health care insurance, sometimes the co-payments are very high, the provider networks are very limited, so even if there are providers, your insurance may not pay for those providers. So, out-of-pocket is just not, most people can't afford out-of-pocket. So if you look at the insurance, restrictions and barriers, there are a number of things there. They're, like, for instance, a visit for a co-payment in many commercial insurances is $40. So if you're not making that much money, $40 a single visit can be quite an out-of-pocket expense. And also, there's supposed to be parity in the United States, which means mental health disorders are supposed to be treated in the same way as physical health disorders. Parity has not been evenly distributed across the country. There are still health plans that do not provide similar coverage for mental health problems that they do for physical health problems. So we've got that obstacle as well. So, when you think about it, there's access to care, there's stigma, there's embarrassment, there's being able to pay for it or afford it. So there's these obstacles. And, of course, being co-chair of the Suicide Task Force, Jerry Overman and I pay attention to this very carefully. The rural suicide rate is 2.5 times the urban suicide rate.
Yeah.
And that, I think, directly reflects on the conversation we're having. Because you put it off, wear down, hopelessness sets in, and then suicide can become an outcome of that process.
The seriousness of your problem just deepens the longer you wait to be treated.
The longer you wait to be treated. Yeah. And so, I mean, the most important thing that I think people can do is, first of all, educate themselves about what resources are available. I often, when I give talks in Indiana even, it's very interesting because I'll go to crowds, I'll say, where's the hospital? Everybody will point over to IRMC. Where's the biggest mental health clinic? People like shake their heads, mental health clinic. And so it's one of those things where people don't really want to know about it until they need it.
Sure.
And so that's not when you want to find out where it is or what services are available. You want to kind of know what services are available. So what I would say to family members and individuals who are struggling, you can contact the Guidance Center. You can call us, and we will help you figure out. It doesn't have to be us necessarily, but we will help you figure out where your closest provider is, help you with figuring out your insurance, where your network is, so that we can help you get the services you need. I mean, we're not jealous and we're not possessive. If you have a provider that's more accessible to you, we're going to certainly let you know that, because the most important thing is you get the care you need.
Yeah, those suicide numbers are alarming as well as...
Yes, very much so.
As we think about this. And you and I were talking beforehand that there's a problem that is trending all across the United States, and that is, it's been a while, people don't know what to do with people who are having mental health difficulties. Issues come up, and they don't know what to do. The automatic thing that people think of is, let's take them over to the ER.
Right.
And hospitals, of course, they're not equipped for that.
No.
They do their best with those patients when they come in. They're certainly not going to turn them away. But what it ends up is, that's a roadblock, I guess.
Hospital emergency rooms are squeezed across the country because what's happened, and let me give you a number. In 1955, there were over 800,000 psychiatric beds in the United States. That number in 2016 was down 97%.
Wow.
There are only a few 10,000 beds in the entire country for psychiatric services. In the state hospital system, which used to be there to help people who are poor, didn't have resources, in Pennsylvania, we had 36 state hospitals in 1959. We have 5. 5 in the entire state. And those beds are profoundly limited. Now, the good news is a lot of treatment is in the outpatient setting now, so you don't need quite as many beds. But when you need them, they're not there. So what happens is people go into the emergency room because that's a natural place you go when things are really bad. We wouldn't want to discourage that. The issue is the emergency room then gets filled up with people who are in significant psychiatric distress, but there's no beds. We have people in the emergency room, and I know the psychiatric liaisons there very well. There are people that are in the emergency room not because they're not getting appropriate care, but because there's no availability of psychiatric beds. They're there for days, days in the emergency room because there's just not an availability of medically necessary psychiatric beds. And this is a really complicated issue. Part of it is because the treatments in outpatient are much better, which is good. But the other part of it is that the funding for inpatient psychiatric services, like outpatient psychiatric services, is much less than traditional medical services. So if you're a struggling community hospital and you need to maximize your survivability, then you look at cardiology and you look at other things where there is a possibility to at least survive, but psychiatric reimbursement is low. So you're not going to be building, a small community hospital is not going to survive if it attempts to tackle this issue itself. So it's a complicated issue from the financing perspective, but also from the perspective of a lack of resources.
A lot of things that make this a very, very insidious and serious problem. So the question becomes, what are the solutions? What are people doing right now to address this?
Well, I know Jim Struzzi has got a bill that he put up, and it's co-sponsored in Pennsylvania, to look at this problem systematically across the state. What are the issues? What are possible solutions? Getting all the partners at the table, looking at what we need to do in terms of bed availability, emergency mental health services. Now, in Indiana County, we're pretty fortunate in the sense that we have the crisis number, the 877-333-2470 crisis number that's 24/7 that you can always get help to talk to. But we are also in Indiana County kind of limited because we don't have a fully committed, full-range psych unit in Indiana County. So the hospital gets the burden of holding on to people until something can be done. So, and we're not unique. I mean, this is not a unique problem to us. So I think that we have to have a systematic examination of this dilemma, not only at the state level, but the federal level, and say, look, what do we need to appropriately serve people with mental illness? I mean, we can't just push it down, kick the can down the road, so to speak, and like not think of it as a priority. It is a priority. The suicide rate continues to go up, and we've talked about that here a number of times. We got an increasing suicide rate in this country, and we're the only industrialized country in the world where that's happening. So we've got to look at this in a very broad way in terms of mental health needs, education of the public, breaking down stigma, breaking down that sense of embarrassment that keeps people from getting help, and looking at improving access, improving the ability for people to get the help they need when they need it, close to where they need it.
Yeah, and the results, of course, also include the mass shootings that we're seeing across the nation, other crime that, are specifically laid off to the fact that the perpetrator is mentally ill.
Well, and if you look at mental illness in general, mental illness people are not more likely to commit crimes than anyone else, but there are a select small group of seriously mentally ill people who are not getting treatment that are at higher risk. The issue also that we need to consider very carefully here is that when you look at access to services, is that the lower access to services areas typically are the ones that have the greater issues. And so we have to find a way to penetrate and create greater access for people in rural areas. We're trying to do things at the Guidance Center like telepsychiatry, where our psychiatrists can do video conferencing, can actually do video conferencing. But even there, some of the insurance companies won't allow that. So there are still some I would say ancient restrictions that are limiting access to care that we need to work on.
Yeah, okay. So for somebody who is looking for signs of mental illness and someone who's close to them, or someone who believes that they have seen signs of mental illness, I guess that's the better part, or the better way to put that. What do they do in Indiana County, the Guidance Center?
What they can do is, if it's a crisis, they can call our crisis number, which is the whole county crisis number, 877-333-2470. And they can call the Guidance Center at 724-465-5576. The Guidance Center has walk-in intake, which means if you just come on down. I mean, you can call and schedule an appointment you want, but I'm very proud of our system. We have a come-on-down model, which is like the emergency room. If you have a mental health issue, you need to be seen right away. My people will see you when you come in.
Yeah, well, that's wonderful, and certainly much needed. This is an issue we're not going to solve this in 10 or 12 minutes.
No, we're not. We're just going to continue to raise awareness and continue to keep it in front of the public eye, I think.
All right, let's talk about this again real soon, okay?
Thank you, Todd.
He's Dr. Ralph May, and again, the number, if you are noticing signs in someone you love or you notice it within yourself, for the Guidance Center.